Good morning. My name is Bernie Dunker, and I'm the Associate Vice President, Research and International at the University of Waterloo. Before we begin, the University of Waterloo acknowledges that much of our work takes place on the traditional territory of the neutral Anishinaabe and Haudenosaunee peoples. Our main campus is situated on the Haldimand Tract, the land granted to the Six Nations that includes 6 miles on each side of the Grand River. Our active work towards reconciliation takes place across our campuses through research, learning, teaching, and community building, and is coordinated within our Office of Indigenous Relations. I'm so pleased to welcome you here today for the University of Waterloo's 3rd annual Friesen Lecture. Each year, the Friends of the Canadian Institutes of Health Research award the Henry G. Friesen International Prize in Health Research. This year, we are thrilled to welcome Dr. Zulfiqar A. Bhutta, Distinguished University Professor and Founding Director of the Institute for Global Health and Development Center of Excellence in Women and Child Health at the Aga Khan University. He also holds the Robert Harding Inaugural Chair in Global Child Health at the Hospital for Sick Children and is co-director of the SickKids Center for Global Child Health. We'll be starting off with a special panel session ahead of the Friesen Lecture later this morning. The lecture delivered by Dr. Bhutta is entitled Addressing Maternal and Child Health and Sustainable Development, the Do's and Don'ts of Doing So Equitably, and the topic of our panel session is Sustainable Development Goals for Women and Children. Before I introduce our panel, I'd like to invite Dr. David Malkin, past president of Friends of Canadian Institutes of Health Research, to say a few words on behalf of Friends of CIHR.
I'm the immediate past president of Friends of CIHR, and it's really a great pleasure to be back here in Waterloo to help host this year's Friesen Prize program. The Friesen Prize and related events are related to Friends of CIHR, which was developed about 20 plus years ago now, led by Dr. Abby Angel, who is the founder and president for many, many years. And the concept really is that Friends advocates for health policy research to support the mission of CIHR, as well as health research really across the country, particularly in supporting the goals and ambitions of young investigators and junior scientists. And I noticed a number here, which is amazing. So we'll hear a little bit more about the lecture, which is kind of the sort of the central core of the program. And Dr. Bhutta, as prior lecturers, travels around the country over a period of a few months in little pockets and giving lectures, having panel discussions, meeting colleagues, and so on in particular fields. And each year, a different laureate is nominated and named. And so the area of research and study often can be quite varied across the country. But the honor of the Henry G. Friesen International Prize is to an individual who has really mounted significant leadership in health research nationally as well as internationally. And Dr. Bhutta, of course, exceeds all of those, as we know. So about 9 years ago, this concept of having round tables together with the lecture was developed, and the idea there is at each institution to bring together a group of individuals with expertise related to that of the laureate and have really an open discussion about significant issues in health policy and health research that are near and dear, and there's expertise within that university community. And of course, Dr. Dunker will be chairing this panel and introduce our panelists. The focus of today is going to be, as you've heard, on addressing maternal and child health issues. And really, this is Dr. Bhutta's claim to fame, perhaps the most cited scientist in the world with an H-index factor, which boggles the mind, and citation index factor, which also boggles the mind, but really has focused his outstanding work on the first 1,000 days of life. And it's been my great pleasure, even though we're at the same institution over the last little while, back in November, we're in Ottawa, Montreal, and Toronto, to spend a lot of time with Dr. Bhutta and another hour and a half in the car here, just talking about everything, not just science, but also an incredible humanitarian, a credible individual, and it's just really been my pleasure to count him as a very close colleague and now a very close friend as well. So I'll leave it there and have a fantastic panel and pass the microphone back to you.
Thanks so much. Okay, I think what I'm going to do is I'm going to introduce the whole panel to you right off the top, and then each panel member will have a chance to tell us a little bit about their work and their perspectives about sustainable development goals for women and children, and then we'll enter into more a general Q&A and sort of discussion part of the panel, if that sounds good. So just bear with me, and we'll do all of the introductions right now. So just to add a little bit to what was said about the bio for Dr. Bhutta. Dr. Bhutta was educated at the University of Peshawar, obtaining an MBBS, and then went on to a PhD from the Karolinska Institute in Sweden. He's published 10 books, over 150 book chapters, and as was said, over 1,200 index publications to date and citations off the charts. He's one of the most highly cited academics in global health and is ranked among the top 1% of highly cited researchers globally by Web of Science consecutively each year since 2013. He's been a leading member of the major Lancet series, reflecting his advocacy in global health, whose evidence-based interventions have strengthened global health research policy. Dr. Susan Elliott is a health geographer and university chair in health geography at University of Waterloo. She has a highly active research program with over 250 publications related to global environment and public health, with an emphasis on WASH, gender, aging, violence, and vulnerable populations. She has undertaken a range of roles administratively, including director of the Institute of Environment and Health when she was at McMaster, senior research fellow in the United Nations University Institute for Water, Environment and Health. She was also dean of social sciences at McMaster, and then came over and was a dean here, the dean of health sciences at Waterloo. And then she recently was a chair the Department of Geography and Environmental Management, and I had the great pleasure until recently of co-chairing the Waterloo Awards Committee with Susan, which she's continuing on with my colleague Ian Milligan. She has a real commitment to impactful research in the area of global health, and her research is characterized by strong science policy bridging, as you'll hear about today. So going down the table then, we have Dr. Zahid Bhutt. Dr. Zahid Bhutt is a physician, an infectious disease epidemiologist with over 15 years of public health experience. He's an assistant professor in the School of Public Health Sciences at the University of Waterloo. His research applies a syndemic framework to examine interrelationships between epidemics and of infectious diseases, social disparities, comorbidities, and substance use using epidemiological, statistical, spatial, and machine learning methods. His concurrent areas of interest include pandemic preparedness, digital public health and epidemiology, global health, spatial epidemiology, and public health informatics. Dr. Hannah Neufeld is an associate professor in the School of Public Health Sciences at the University of Waterloo and holds a Canada Research Chair in Indigenous Health, Wellbeing, and Food Environments. Her community-based research with Indigenous communities spans close to 25 years and continues to investigate the complexity of food environments utilizing life cycle and intergenerational perspectives. She has led 2 co-edited volumes, Indigenous Experiences of Pregnancy and Birth, and Recipes and reciprocity, building relationships and research. Globally, she has contributed to maternal child health and nutrition policy, knowledge translation platforms, and reports for United Nations agencies such as the World Health Organization, the Food and Agriculture Organization, along with the Intergovernmental Panel on Climate Change. And we also are very pleased to have Dr. Charity Oga-Omenka joining us for the panel this morning. Dr. Charity Oga-Omenka is an assistant professor in the School of Public Health Sciences here. Her research interests focus on global public health, healthcare access and services research, particularly related to infectious diseases like tuberculosis, HIV, COVID, social determinants of health, and the intersections between health and equities, using mixed methods research. She is invested in research that focuses on transformative conceptual frameworks and methods to address the inequalities and underutilization of evidence-based approaches in global public health, particularly in resource-limited settings or with marginalized groups. Thank you all for being part of the panel this morning. And we'll start off with some of your reflections, some of your work, and we'll start off with Dr. Bhutta.
Thank you very much, Dr. Unke. And sorry that we were delayed coming in. I've got a mic. So thank you for that really warm reception and introduction. The more I think about this, some of these numbers and metrics actually just reflect my age. And the fact that I was there at the time when people were beginning to recognize that there were issues in relation to both the Millennium Goals and global health that particularly impacted women and children. And I'll have an opportunity to discuss that with you a bit later. But stepping back to the topic that we have in front of us, Sustainable Development Goals, let me start by asking the audience, who represent, I think, a mix of people here. How many people are actually able to count the 17 Sustainable Development Goals in the room? Don't be shy. Put your hands up. A couple of tentative hands. And you know what? That is not an unusual response. Because as I travel the world and as I speak to people about SDGs, I can give you an example from last month in Lahore in Pakistan, where I asked the same question of the University of Management Sciences, Health Sciences, a room full of people, if they knew what the SDGs were. And the answer was, SDG what? And that's a big contrast to the Millennium Development Goals. And one has to therefore ask oneself, these goals that were crafted and signed by every country in the world, not just low and middle income countries. So the difference between the Millennium Goals and the Sustainable Development Goals is that SDGs were signed by every country in the world. They're just as relevant to Canada as they are for Latin America, Africa, and Asia. So the SDGs principally belong to everybody, and they're relevant to every country. Yet, we have not been able to inspire the interest and also the discourse, debate, discussion, even though they include many of the things that we'll speak about today, such as concepts of inequality, justice, fairness. So the big question is, why have they not inspired everybody? And one sad fact is that the SDGs, indeed, although they were signed at the end of 2015, were derailed within a few years by, number one, the pandemic, which took away a big chunk of everybody's life, and the SDGs were truly interrupted. And then following the end of the pandemic, the world has just had a sequences of challenges, whether it's conflict, whether it's climate change, whether it's cost of living crises. So these polycrises have absolutely focused attention on things other than the core Sustainable Development Goals. And as a result, one of our big challenges as countries are beginning to imagine that these SDGs are, number one, unattainable, number two, that we should look beyond them, and number three, that we should probably look at a subset of the SDGs as maybe a target that brings things together. And just as I close and pass on to my colleagues, and I'd like to hear their views on this, to a large extent, I think the blame lies in the laps of the UN agencies, whose task it is to keep the SDGs in the forefront. So they've been distracted to a large extent by events that are beyond their general broad planning exercise. For example, the WHO for the last 2 years has been completely distracted with trying to get consensus around the pandemic instrument, and a very narrow focused discussion on the pandemic instrument. Similarly, UNICEF is missing in action. And many of the organizations like WFP, FAO have been just so hunkered down by the humanitarian response needs that they have, that the totality of sustainable development that was around the core of SDGs was lost. Maybe you could say climate has risen up to the fore, and I'd love to hear from Sue as to what she thinks. But I think on climate also, the linkages between, for example, health, nutrition, climate, have been tenuous at best. This year was the first time that we had a health day, not even a health stream, at COP28 for climate and development. And to those of us who went there, it was a bit disappointing to see how little discussion there was on the fundamentals and on some of the issues around how do you address the needs of low and middle-income countries within the same context. So I'd love to hear from my colleagues and answer questions from the floor, but the Sustainable Development Goals are real. And there will be a reckoning by 2030 as to how the world has responded. And it's not too different from the MDGs, where people woke up to the MDGs right around the middle of the entire process. The MDGs were signed in 2000, supposed to end in 2015. By the middle of the MDG process, 2005-07, when we did some of our first Lancet series around it, we found that many countries had not actually risen up to the challenge. But then there was a real scrum and a race to the finish where many people did accelerate. And my hope is in the second half of the SDGs, something like that might happen.
So I can't do things without slides. So I'm going to walk over to the podium, and I want to thank Zulfi as I'm doing that for that wonderful introduction. Because this is what I want to talk about today. 3 through 6 via 5. I do not think we will achieve SDG 3, which is the most important in my view, and I think in most people's view, which is health and well-being for all by 2030. We will not achieve that unless we have water and sanitation for all. Water is the stuff of life. That's SDG 6. What is SDG 5? I do not think we will achieve those two things until we first empower women. And I have 5 minutes, so I'm going to tell you 5 reasons why, and then I'm going to tell you how we should do that, or at least my perception of how we should do that. Number 1, 1.4 million deaths and 74 million disability-adjusted life years could have been prevented by Safe Wash in 2019. This is a big problem globally. Globally, 1% of the Canadian population does not have access to safe water and sanitation. We are now 40 million people. And we know that that 1% is our most marginalized populations and primarily our indigenous populations. Richest country in the world, biggest country in the world, spring 2020, 90 US cities had to pass legislation to force privatized water companies to turn water back on to low-income households in poor neighborhoods so people could wash their hands to stem the spread of the violence. Those people had had their water cut off because they couldn't pay their water bills. And Rodrigo, who's here today, one of my PhD students, doing work in Brazil on the role of drug cartels in Brazil in interrupting access to wash in poor communities. Why is this a women's issue? Women spend 200 million hours daily on a global scale searching for water, and 260 million hours daily searching for a place to relieve themselves. We cannot talk about water without also talking about sanitation. Women and girls experience violence in their search for adequate wash in their communities. And my postdoc, who's Abraham Numbogo, who's at the back there, put your hand up, has done tremendous amounts of work on the types of violence women experience. It can be sexual, it can be physical, it can be psychosocial, it can be structural. And I have stood in forests where headmasters of schools have said, this is where the little girls come to relieve themselves because we don't have sanitation facilities, and adult men are here waiting for them. Finally, number 5, this is a map of female genital mutilation. We know these numbers are horrendously underreported. And why is this important? Because we know that as a result of the impacts of climate change and major events like floods, droughts, farmers are having a hard time feeding their families. Their yields are not what they used to be. Fastest way you can make a chunk of money to feed the rest of your kids is by selling one of your girl children into marriage. So more and more girls are being sold at younger and younger ages, and many of them have to be circumcised before they can be sold. And we're talking about little girls who are 4, 5, 6 years old being sold into marriage as a result of the health impacts of climate change. This is a women's issue. So how do we do this? This is a new book that just came out on equity in global health research. It's an edited volume that addresses these principles of equity in global health research, which have now been adopted by CIHR in their strategic plan and by RDRC. The book actually is an edited work where each of the chapters explicates illustrations of how these principles can be applied in doing global health research. They made me do the humility chapter. I think they did that because they knew it would be the hardest one to write. But in the process of writing that chapter, I really had to reflect on who I was as a researcher, and I realized being a humble researcher makes me a better scientist. Here's an example why. A couple years ago, IDRC, SSHRC, and CIHR came together with this funding called Women Rise. How can women build back better after COVID-19? Because we know globally women were more impacted. I have partners on the ground in Kenya and Uganda. I got them on the phone. They're EDs of local NGOs. And I say to both of them, okay, I can apply for $1 million. Tell me, what is the biggest problem women experience during COVID-19 in Kenya and Uganda? What's the biggest problem? Just tell me and I'll write a grant about it. They said, teenage pregnancy. I would never have suspected that that was an issue. Why was it an issue? Uganda experienced the toughest, most extensive lockdowns in the world. They're used to dealing with Ebola. They know how to deal with a pandemic. They locked down schools. Girls were not in school. School is a safe place for girls. Tremendous urban to rural migration. People leaving the cities because they lost their jobs, didn't want to get involved in lockdown, so on and so on, moving back to the villages. Now we have an entire generation of young girls who are now going to be raising babies, and how are we going to deal with that issue? So very fortunately, we write a grant, we got $1 million, and we're working on that. But if I had not been humble enough to ask, what's the biggest problem you're experiencing, we would not be in that space. So that's my take-home message, 3 through 6 via 5, and that's our website if you want to learn more about us.
Who's published the book?
Thank you, Dr. Elliott and Dr. Bhutta, for setting the I think, tone and direction of the discussion. It's great that, Dr. Bhutta talked about the impacts of pandemic, and I think we really don't kind of estimate what kind of impacts that the pandemic has on the Sustainable Development Goal. Just a fact, we are on track only one of the 18 sustainable indicators under the SDGs will be, getting close to the target. So, we are quite behind in terms of reaching the Sustainable Development Goals. In terms of the impact on gender equality, which is SDG number 5, there has been a UN Women report on, which is known as Snapshot 2021, which shows really grim statistics about gender equality. And I would just like to present some of these facts. If you look at job losses during the pandemic, women faced steeper job losses than men. In terms of numbers, because I'm a quantitative person, number of employed women declined by 52 million in 2020. And strikingly, 45 million left the labor market altogether. So this is a global estimate. And as we know with all estimates, there's a lot of underreporting with these figures. What we also saw during the pandemic, that we saw an increase in poverty. And that also was impacted a lot on women. Just a number, 55% of mothers with newborns receive no maternity cash benefits. And even before the pandemic, there were a lot of countries which didn't really offer any maternity cash benefits. In terms of food insecurity, as we all know, food insecurity was higher during the pandemic, and it's still continuing, but it impacted women more than men. Women's food insecurity levels were 10% actually higher than men's in 2020. And since this is a 2021 report, if there is a newer report, we'll see the impact of what's happening, you could say, like when the pandemic is in the endemic phase. In terms of education, if you look at education, we see that half of all refugee girls that were enrolled in secondary school before the pandemic will not return to school. So you can just imagine, and this is just an indicator where they looked at refugee girls, but there could be other indicators that focus on girls who attend schools. And I think Dr. Elliott just gave an example of that. Interestingly, COVID-19 also increased women's workload at home. During the pandemic, women with children at home spent 31 hours per week on childcare. So you can estimate their productivity loss because of the pandemic. And also, I think when you tie it together with unemployment, it's a lot. It's really exponential. One of the interesting parts, what they talk about in the report is the clinical studies. So only 4% of clinical studies on COVID-19 treatments considered sex and gender in their research. And I believe that, so this is just clinical studies, but I believe that if you look at other studies as well, other research, I believe this number would be similar. So you could see that not only women are facing the impact of the pandemic in other ways, but also in terms of research, it's a very understudied topic. And I think we should be doing more in terms of when we are looking at research. Finally, let's talk about government decision-making power. So what is surprising is only 1 in 4 parliamentary seats are held by women. And this is a global figure. And you could see that if that is the case, then you could see like the decision-making power is quite less. And it's less so in conflict-affected countries. And now what we are seeing is, you're seeing actually the impacts of the pandemic, which are actually affected also by the ongoing conflicts. And once you have these two together, then you can know that the effects of the pandemic on gender equality are really underestimated. And I don't know, like if you do a rough calculation, we think that the countries will achieve the SDGs by 2030, but I think if you do a rough estimate, until unless there's a very good coordinated global response, we may achieve it, but it would seem that it has really, we may not achieve it maybe by 2045 or 2050. So it's quite a grim figure in terms of when you're looking at whether we are able to achieve the SDGs, especially when it ties together to gender equality. And I won't talk more about SDG 6, clean water and sanitation, but that is also like a major issue that has been affected by the pandemic. Thank you.
Good morning, everyone. Thanks for coming out. Thank you. On such a cold morning to be part of this event today. Thank you for the opportunity to be part of the panel on this important topic, and really good to meet you, Dr. Bhutta, as part of this and learn more about your work. For my part of what I want to present today, I want to touch on a few SDGs as well, but I kind of want to bring it down from this kind of high-level global look in terms of maternal child health and bring it down to the experience of an individual, an Indigenous woman who is part of a project that I'm working on that I'll set up in a minute. But I wanted to share her story in the form of a digital story. Hopefully that works for this morning. But I think what I want you to think about as you're watching her story is some of the SDGs that we've touched on, particularly, as Susan mentioned, good health and well-being, SDG 3. And I also think the story touches on SDG 2, zero hunger, as Zahid talked about too, in terms of food security. SDG 10 in terms of decreasing inequalities when it comes to Indigenous peoples, Indigenous communities within Canada, and also SDG 11 when we think about what is required to achieve sustainable cities and communities, not just in terms of their ecology, but also in terms of their social connectivity. Particularly for the groups that I work with. So I mostly work in the area of Indigenous health in general, but working within urban centers. So this project that I want to profile one of the participants is called the First Foods Project, and it's looking at supporting Indigenous women in cities in terms of infant and young child feeding and supporting infant and young child feeding. Many women are living away from their home communities, so it's a unique circumstance in terms of helping to support them, not even just during the pregnancy process, but in terms of that postpartum, that critical piece of postpartum when breastfeeding is encouraged and promoted as it was traditionally in Indigenous communities. So maybe just with that setup, I'll just introduce, this is Bethany Flett's story, and she's titled it A Mother's Story.
As a kid, I would have a dream about going home on the train. Today, I still have that dream. I am a Saisi Dene woman from the north. I am a breastfeeding mother. I always dream of returning there to raise my children. I have come to accept that I may not be able to raise my children in the north. I do wish that my children will have the freedom to return there and raise their own. As women, we hold a lot of power. We hold the weight of our families on our backs. People talk about Indian residential schools and the 60 scoop as it is in the past or as if it is history. Our children are still being taken. Our families are still being torn apart to this day. Our families hold a lot of trauma from what the government, CFS, has been doing for generations. They took lots from us, but we are still here. from the strength of our mothers, our grandmothers, and great-grandmothers. I didn't have the family support or resources to breastfeed my oldest children. I only breastfed my first daughter for 2 weeks and my son for only 6 months. Family would take him from me to feed him a bottle, so I couldn't breastfeed him. Our own people are doing this to us. We need to reclaim our power back. Nayalkai's name means Northern Lights in Saisi Dene. Her name holds the strength of her ancestors, the strength of the woman before her. Her father and I are both from the north. I thought that name would be the most perfect name for her. Breastfeeding my daughter, Nayalkai, is the most powerful bond with my child. Nayalkai is a beautiful soul. I am beyond grateful she picked me to be her mother. Greeting her and carrying her in my body, feeding her with my body, creates a strong, trusting bond with my child. Nayalkai's father was the only person who supported me with breastfeeding, encouraged me when I felt discouraged. Without his support, I wouldn't have been successful. That is how it should be for breastfeeding mothers, is to have all the support in the world from family, partners, and supporting systems. A mother needs a strong community standing beside her.
Thank you. I'll leave it with Brittany's words, and I'll pass it along to Charity.
Good morning, everyone. Good morning. Thank you for inviting me to be part of the panel. I'll dive right in. So the world is failing women on all the SDGs, particularly Goal 5, right? And it's not too much of a stretch of an imagination to think that when women are impacted, then their children are also impacted. The younger they are, then the worse it gets, right? So global development is currently focusing more and more on societal norms. All of us abide by some societal norm or the other. I mean, that's how we interact with the world. That's how we navigate the world. But some norms, particularly those that guide how different genders interact, how we perceive people from different genders, influence health risk and access and quality, and disproportionately affects marginalized populations. So growing up as a young girl in West Africa, I've always been acutely aware and influenced by the boundaries that society places on women, right? But I never imagined how life-threatening it would be until I was collecting data for my PhD in 2017. I was working on access to drug-resistant tuberculosis. This is a strain of TB that is very resistant to treatment. The drugs are very toxic, and people die. Even people on medication die very often, right? And so while I was finding out, doing interviews, doing surveys with people, the hospital, the National TB program gave me access to diagnosis ledgers. And through that, I found people that had been diagnosed that were not treated. So I contacted, we collected this, and we're trying to reach out to the patients to find out, why are you not on treatment? And so one case that sits with me is that of a young woman in her 20s who was diagnosed positive, of course. And then we reached out to her, and she's like, yes, I want to be on treatment. So we're on the phone with her, trying to connect her with the healthcare team. And then the phone, we just hear some commotion, and the phone is snatched from her. And an angry male voice shouts into the phone, telling us to never contact his daughter again, that he believes his daughter has been healed by faith, and he doesn't want his daughter to have anything to do with us. And so what struck me even more was the helplessness of the national program in intervening. You cannot cross family wishes. You cannot, are you going to rehouse those people after you've taken them away from their families? So the national TB program was stuck, and there were several cases like that, women and children prevented. Not a lot, but enough for me to, like a jolt, right? And so there were also cases of women that required permission from their husbands to access healthcare. So last year, like very early into my position here, I started reflecting, what are some things that I want to work on? And this came up because it's very personal for me being a woman, and also because of my experience in other research, in health research, global health research, seeing how limiting it can be for women. So I am currently doing a literature review and pilot survey on advancing women's autonomy. So right now, as of last week, we surveyed 56 experienced clinicians and researchers from Africa, Asia, Europe, and North America. So we asked them, what are the cultural norms that are most prevalent in the region that you work in? And so we found that the primary role, women's primary role as caretaker, and then women having more value if they are married with children. So if you're married without children, it's a problem. If you're not married, it's a problem. These were prevalent in most of the regions that answered our survey, right? And so decision-making autonomy also came up as an issue, right? And then wife beating. Surprisingly, you think that in 2024, no one is beating their wives, but no, that's happening still, right? So there are regional differences, right? In African region, participants agreed with all of these gender norms. In the Southeast Asia, participants agreed with 4 out of 5. They did not agree with the wife beating. In Europe, people agreed with 2 out of 5. Value as being wives with children. And then in North America, they just agreed with the caretaker role. Now, in terms of empowerment programming, what has been the progress that has, what's been the progress so far in the region that you've worked? Overall, all the regions agree that education has improved. Healthcare improved as well, but not in all regions, in 4 out of 5 regions. Reduced violence and access to land and political positions were not agreed with. The healthcare workers we interviewed did not agree with that. Now, the region with the most progress has been Europe on all 5. Improved access to education, healthcare, land and credit, political decision-making, and gender-based violence. In Asia, it was just 2, improved education and healthcare, as well as in Africa. In America, just 2, education and political positions. Now, also, I'm doing like a literature review trying to understand how do we intervene with cultural norms? How do we begin to change people's minds about the way they've been doing things, that their grandparents have been doing, their great-grandparents have been doing things? How do we change that? So what we've seen is that there are different types of interventions. There's advocacy, there's media, so many types of interventions focusing on gender equality, violence, family planning. And so the actions that are being targeted are cultural norms, basic rights, access to social and health services. And the strategies that are proven to work are those that address the ecological framework, like not just focusing on the individual, but looking at the individual as part of the community, as part of a family, as part of the society. And then when peers are engaged, like similar women working together, those strategies work. And also the use of role models also seem to work. And then having people in the society, in the communities act as agents of change is also one factor that seems to lead to success. And finally, when you design with communities like Dr. Elliott mentioned, those are strategies that work as well. So another point to note as I round up is that when we go into communities trying to do any kind of work, we need to be culturally sensitive. No one wants to hear, oh, this is how things are being done elsewhere. Work with them to find out what their issues are and find out how can we change this. This is affecting women, it's affecting children. How do you think we can change it? So designing with communities to ensure that we are bringing culturally sensitive interventions will be key. Thank you.
Thank you so much to all the panelists for your powerful perspectives on the topic for today's discussion. I'd like to now open it up to the audience for your ideas, your experiences. I know we have a lot of graduate students here today who are doing very relevant research, or questions you might have for the panel, and we'll have one of the organizers do some mic running. If anybody's got, please put your hand up and we'll have a mic to you. Yeah.
Hi, good morning. Thank you so much for your talks. Some of you mentioned some cultural challenges like female circumcision and traditional gender norms that are normalized in certain parts of the world. And sometimes when reading about these topics, we are introduced to the challenge of maybe adding a colonial lens to these issues when addressing them. So I wanted to know, how do you think researchers, especially researchers working from the West, should position themselves when addressing these issues? Thank you.
I can start. I think that that's a really great question, and I struggle with that a lot in the work that I do, which is why I tend to, at least in my research, be mostly involved in qualitative and arts-based methods that are profiling the narratives and the stories of the participants themselves. So that's why even today, instead of trying to generalize some of the work that I do, I think it's really important to drill down to those perspectives, especially when you're talking about aspects of colonization and those structural impacts and how they've impacted matrilineal societies, like the indigenous cultures that were here in terms of the Haudenosaunee peoples. It's a matrilineal society, and how that's been impacted by colonization and the paternalistic aspects of colonization most specifically. And just to give another example too, of another project I'm engaged in with looking at food environments and looking at different generations' perspectives on food environments in partnership with the community of Six Nations and Six Nations Health Services. It's a photo voice study, so it allows participants to take pictures of what they deem are the most important aspects of their food environments. And in terms of qualitative research, there's that subjectivity that goes into it as well, but I think it's really critical to convey as much as possible perspectives from those Indigenous perspectives and try and drill down to where those perspectives are coming from within the context.
Okay. I can go next. So as someone that has worked in the global South and now working in the global North, I would say that, just like my co-panelists have said, being humble, designing with communities, hearing their stories, involving them in the intervention, and nothing top-down would work most. These are the interventions that are most likely to take, right? I'll give an example. One day, my younger sister, growing up, had a sleepover, and then she came home, and she wanted to change our house to look like the house where she had the sleepover. So she's like, Mom, we should move the chair from here. We should do that. You can imagine the reception that she got. No one wants to be told that this is how other people are doing it. You have to follow you have to work with them. You have to ask them questions, find out from them, like, do you even see that this is a problem? Right? Is this an issue in your community? Have you heard of people that have suffered adversely from this? Listening to these stories and working with them, you've had all this education about things, and you've read, and you know what might work and might not work, but you're coming as an ally. I guess that's what I'm trying to say.
Thanks so much. I agree very much with what my colleagues have said. And I do think humility is the most important aspect of that, to ask. Don't go places you're not invited. Always work with partners and ask, what are the questions that are important to you? And I firmly believe, because we're all researchers, we're all committed to excellent science. That's why we're here. That's why we're in the roles that we're currently in. And I do firmly believe that being as humble as you possibly can makes you a better scientist. I used to teach about type 1, type 2, and type 3 errors, where type 3 errors were asking the wrong questions. So making sure you've got the question right, making sure you've got the methods right. And I'm smiling a little bit because I can go into a community now where I've been working for a number of years in Kenya near the lake, and I can say, well, who's the best person to go out and collect data? We just did 1,000 interviews with women for the Women Rise project in these communities on Lake Victoria in Kenya. Well, we use the community health workers. They're the best survey researchers we've got. They're amazing. Mm-hmm. They know how to go out and collect survey. Not only that, they know everybody who lives in every single household. So me being able to say, so tell me, what's the best way to collect the data? They say, we've got people. We'll pay these people. They'll go collect the data. Now I have the best data, which makes me excited as a researcher, right?
Great. Other questions? Yep.
I was actually struck by a comment, which is almost in passing, Dr. Bhutta, that you had made about the fact that 1 in 20 political leaders are women, or 1 in, I can't remember these. 1 in 4, yeah. Which made me wonder, is there any sense over the decades, or over the last few decades, of differences in countries where women are political leaders versus those that aren't, or changes of leadership from women to men or vice versa, recognizing perhaps that some of those countries are not exactly low income, which I suppose challenges the problem. But are they able to actually move legislation even in those countries that have impact, or does it really matter?
I think that's a really, really good question, and I don't really think that people have looked at it this way. So I guess there's an area of research here that we could study, but I think what it highlights is that we are not seeing that much of women's representation. And you're right, like in a sense that there are countries where you have seats for women, but they are not really. They're like just like a quota for women. Like they don't have really a decision making power there. So it's just like to show people that yes, we have women in our parliaments. So yes, in those countries, I really don't think like if you have like them on those seats, they would have that decision making power. That's correct. The other thing what we saw during the pandemic is that countries that were led by women, especially like if you take the example of New Zealand, they fared better at managing the pandemic. So that shows something. That shows that if you put women in leadership roles, they actually might do a better job than men in those cases. So, but as I said, like it's an interesting area of research to see like if you have more women representation in the parliament, does it help you making better policies, better decisions? And when you have the change, let's say to more men in the parliament, what change does that? Yeah.
Is there any? I'm thinking of particularly Pakistan and India, where you have, now this going back perhaps 2 decades, but you had Benazir Bhutta in Pakistan as a leader, and Indira Gandhi as a leader in India. Were there anything?
Do you want to go, Sue, or shall I answer?
Well, I was just going to give you an anecdote, actually, and then we'll hear your answer. But my anecdote is I was in Kisumu in Kenya, third largest city in Kenya, right on Lake Victoria, in June of this year, having a meeting with local water stakeholders and water researchers about a new NFRF-funded project. And the Minister of Environment, Water and Security was there, and she was a woman. Most of the people around the table were men. She stood up and pounded her fists on the table and said, "What are all you men doing here? Water is a women's issue. We need women around the table to solve this problem." So I do think it makes a difference, but that's my N of 1.
So actually, David, this is an issue that's been studied. not just in the context of COVID, but also in the context of global governance. And perhaps I can summarize our collective learning, which is still incomplete in a few points. Number one, much more than individual women leaders, it's the whole structure of governance. And the evidence around effective leadership largely relates to local governments as opposed to somebody being just in the apex position. And often you find that sometimes when even women have been in apex positions in countries, they've not necessarily been Democrats at heart. As we know from many regions, they can be the worst autocrats if they want to. So there is a whole equation of governance, governance structures, and the permeation of gender equality across the political landscape. So as Khalid said, there was a stage when, for example, in Pakistan's parliament, close to around 19% of all seats were women. But it depends on really who they were, and many of them were, quota seats, fixed seats where the political parties nominated who they wanted be in there. But there were also very strong political leaders who emerged from there. They were drivers of change and some really innovative legislation around this. So the second point that emerges is that if you overall look at the analysis of global health outcomes in relation to governance, there is a very clear relationship of, for example, maternal-child mortality and government efficiency index. And the efficiency index includes both elements of grassroots democracy, but also things that I've just alluded to as to how well does it permeate down to levels of local government, subnational. And the last point in that is that if you look at pro-poor policies as a measure of which kind of governments have led pro-poor policies, you'll find that more often than not, it's governments which have been led by Democrats and women at heart who have really influenced innovative legislation. At least in India, at a subnational level, there have been many chief ministers in India who've been women. And if you look at the relationship in that democratic process to how they were able to put things in place, particularly for untouchable women, a lot of the investment around, environmental issues and structural development, those came out of democratic processes.
Okay, if there are no more questions, please join me in thanking Dr. Bhutta and the rest of the panel for a terrific conversation.